Gently place the PRP tube back in the tube rack. After centrifugation, the tube should contain an upper yellowish plasma fraction, separation gel barrier, and the lower red-colored red blood cell fraction. The platelets reside on top of the separation gel. If your tube appears different from the example, reference the troubleshooting section of the video for assistance. On average, about 80%, plus or minus 9%, of the platelets collected in the whole blood will be retrievable after centrifugation. This example demonstrates approximately how those platelets are distributed throughout the plasma. About 97% of the platelets are in the bottom 7 cc's of the plasma, with the majority of the platelets physically resting on the top of the separating gel. Keep this chart in mind when removing the platelet-poor plasma, as it affects the final concentration of platelets. Suspend platelets to prepare PRP by gently inverting the tube horizontally 20 times to mix the plasma with the platelets resting on the surface of the gel. Perform this step while holding the tube horizontally and rotate the device to an upward position. It is important to note that these are not complete upside-down inversions. It is recommended to use gentle horizontal inversions. Vigorous or aggressive shaking, inverting, or handling of the PRP tube may cause the gel to breach and the RBCs to mix back with the plasma. Reference the troubleshooting section if the gel is breached. Aseptically clean the rubber stopper of the PRP tube by wiping it gently with an alcohol swab. Be sure to keep the tube still and avoid agitation. Attach a syringe to the lure adapter of the blood transfer device. Take the tube out of the tube rack and insert the blood transfer device into the rubber stopper of the tube. Push the tube forward until the tube stopper has been penetrated. Invert the tube so the syringe attachment is pointed down towards the floor. Gently draw PRP into the syringe while holding the tube in one hand and the syringe in the other. Pull the PRP into the syringe until all the plasma liquid is collected. Once all of the PRP is collected into the syringe, gently disconnect the PRP collection syringe from the assembled accessory and set aside. Once you have collected the PRP into a syringe, the PRP is now ready for use. Properly discard of all blood collection sharps and tubes in biohazard containers.